Pregnancy is an exciting and life-changing experience for any woman, and it's essential to take good care of yourself and your growing baby during this time. While there are many healthy and nutritious foods that you can enjoy during pregnancy, there are also some foods that you should avoid to reduce the risk of complications, including miscarriage. In today's video, let's take a look at some potentially dangerous foods that can cause miscarriage in early pregnancy, particularly in the first trimester. Without any further delay, let's begin. Number 1. Animal liver. While the animal liver is considered healthy for its high nutrient content, it is important to note that pregnant women should be cautious about consuming it. Consuming liver on a daily basis during pregnancy can lead to a dangerous buildup of retinol, a compound that can be harmful to the developing fetus. However, this doesn't mean that pregnant women need to avoid the liver altogether. Eating animal liver once or twice during pregnancy is considered safe and can provide important nutrients like iron and vitamin A. But since everyone's nutritional needs are different, it's very important to consult with a healthcare provider first to make sure this food is safe for you and your baby's health. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Papaya. Papaya is a delicious and nutritious fruit many people love to enjoy, but it is important to note that unripe or green papaya can be harmful during pregnancy. This is mainly because papaya contains an enzyme called papain, which has the ability to break down proteins and is often used as a meat tenderizer. Unripe papaya contains exceptionally high amounts of this enzyme as compared to ripe papaya. Consuming unripe papaya too much can trigger spasms and uterine contractions, which can potentially cause miscarriage in early pregnancy. Therefore, if you are pregnant, you must avoid consuming unripe papaya, especially during the early stages of pregnancy. Instead, you can opt for moderate amounts of ripe, fully grown papaya, as it usually has the least amount of papain. Number 3. Aloe vera. The aloe vera plant is known for its numerous health benefits and is often used in many skincare products and dietary supplements. However, if you are pregnant, you should avoid consuming aloe vera juice, as it can potentially cause miscarriage. The anthraquinones present in aloe vera juice act as a laxative and can cause uterine contractions, abdominal cramps, dehydration, uterine bleeding, and in severe cases, even miscarriage. While aloe vera gel and its topical skin products are generally considered safe to use during pregnancy, it's best to avoid consuming aloe vera juice or supplements to prevent any potential harm to the developing fetus. Number 4. Pineapple. Although pineapple is a great source of many vitamins and nutrients, especially vitamin C and folate. However, pregnant women should proceed with caution when it comes to consuming pineapple or pineapple juice during their first trimester. This is mainly because pineapple contains an enzyme called bromelain, which has similar effects on the body as the enzyme papain and can cause uterine contractions, leading to a miscarriage or stillbirth. But the good thing is bromelain is usually present in small amounts in pineapple and is generally considered safe to consume in moderate amounts. However, it is always best to consult with a healthcare provider to determine whether or how much pineapple fruit or juice you should consume. Number 5. Sprouted potatoes. Potatoes are a common staple in many households around the world and are a great source of nutrition. However, pregnant women should be cautious when consuming sprouted potatoes. Studies have shown that sprouted potatoes contain high levels of solanine, a toxic compound that can have adverse effects on the growth and development of the fetus. Solanine is produced in potatoes when they are exposed to sunlight for too long or stored under certain conditions, such as high temperatures or moisture. While cooking can reduce the levels of solanine in potatoes, pregnant women must avoid eating sprouted potatoes altogether. Number 6. Caffeine. Caffeine is considered a mild to moderate stimulant, meaning it can stimulate brain activity, which often makes a person feel more alert and energetic. Caffeine is commonly found in a variety of food and beverage products, including coffee, tea, and chocolate. While moderate caffeine consumption is generally considered safe for pregnant women, Studies have shown that excessive caffeine intake can have negative effects on both the mother and the developing fetus. High levels of caffeine during pregnancy have been linked to an increased risk of miscarriage, premature birth, and low birth weight. Therefore, it is recommended that pregnant women limit their daily caffeine intake to no more than 200 milligrams, which is roughly equivalent to 1 12-ounce cup of coffee or 2 cups of tea. As with other dietary choices, always consult with your healthcare provider to determine what level of caffeine intake is appropriate for your individual needs. Number 7. Fish. Fish is generally a great source of protein, omega-3s, and essential amino acids that are essential for the growth and development of the fetus. However, pregnant women should be extra careful when consuming certain varieties of fish, especially during their first trimester. Certain types of fish, such as tuna, marlin, king mackerel, and swordfish, may contain high levels of mercury, which can have negative effects on the developing baby's brain and nervous system. Mercury is a toxic element that can accumulate in fish as they grow in polluted waters. Therefore, it is recommended that pregnant women limit their intake of fish to no more than 2 to 3 servings per week and opt for other fish varieties such as salmon, cod, and tilapia. These fish are usually found in freshwater and are usually mercury-free or have the least amount of mercury. Number 8. Raw and undercooked meat. Raw or undercooked meat can be a source of harmful bacteria such as Salmonella, E. coli, and Listeria, all of which pose a serious risk to the health of both the mother and the developing fetus. These bacteria can cause foodborne illnesses that can have severe and even life-threatening consequences for the baby, such as serious neurological disorders, epilepsy, blindness, and stillbirth. Listeria, in particular, is a major concern during pregnancy as it can cross the placenta and infect the developing fetus, leading to a condition known as listeriosis. So if you are pregnant, always ensure that the meat you are consuming is thoroughly cooked to the appropriate temperature, and always avoid consuming raw, undercooked, and even overcooked meats and poultry, especially processed meat products like deli meats and hot dogs. Number 9. Alcohol. One of the most critical things to avoid during pregnancy is alcohol. While it may be tempting to indulge in a glass of wine or a cocktail, doing so can have devastating consequences for your unborn child. When a pregnant woman drinks alcohol, it can easily cross the placenta and enter the fetal bloodstream. Unlike adults, the developing fetus has an immature liver that cannot process alcohol effectively, leading to a higher concentration of alcohol in the system. Alcohol consumption during pregnancy can lead to a condition known as fetal alcohol syndrome, which can cause facial deformities, intellectual disability, and heart defects in babies. Not just that, heavy alcohol consumption during pregnancy can also increase the risk of miscarriage and stillbirth. Additionally, studies show that children who were exposed to alcohol during pregnancy may experience developmental delays, including learning difficulties and behavioral problems. So if you are pregnant, try to avoid alcohol consumption during pregnancy to make sure that both you and your child are safe from its adverse effects. Thank you for watching and subscribing to the channel. See you in the next video.